My name's Dr Anna McNulty. I'm the Director of Sydney Sexual Health Centre. So Sydney Sexual Health Centre is a publicly funded sexual health clinic. We're based at Sydney Hospital, which is in Macquarie Street, just opposite Martin Place in the city. We're the largest sexual health clinic in New South Wales and see probably in the order of 40,000 people per year. And we manage a range of different sexual health problems, but we predominantly focus on what are called priority populations. And they particularly are outlined in the various New South Wales health strategies. At the moment, the priority populations are men who have sex with men, injecting drug users, sex workers, and people who are aged under the age of 24, as well as those living with HIV and AIDS. We also see anyone who's symptomatic with genital symptoms or anything that could be related to a sexual health problem, and we see referrals from GPs, contacts of STIs. So anyone who says, they've been advised that they're a contact of HIV or any other STI, we also see those people, regardless of whether they're in a priority population or not. Well, we provide a range of clinical services, so most of our activity is around direct clinical care. So we also offer counselling services to people, as well as medical and nursing services. We have outreach services to a range of different sites. So we have a youth service that we run at Bondi Junction, which is hosted in a service called Ways. We have a partnership with ACON and run clinics there at their main site at Surrey Hills near Central Station, and also on Oxford Street near Taylor Square. We also offer health promotion, so we target in particular the priority population. So we have projects that target young people and gay men and sex workers, particularly sex workers who come from Chinese or Thai-speaking backgrounds. We host a statewide service called SHIL, which is the Sexual Health Infolink, and that's a sexual health nurse-led information line that answers inquiries regarding sexual health. It has a range of other functions as well in terms of improving access to care for anyone with an STI or HIV. Well, Sydney Sexual Health Centre also offers clinical placements for medical students, nursing students, practice nurses, counsellors. We have a comprehensive research program, and we develop resources that are used, both at our service and more broadly across the state. So we are involved in the Playsafe website, which is predominantly an initiative of New South Wales Health and STIPU, but within that website there is the capacity for people to ask questions. So we post, there's a blog posted every 2 weeks which answers a question that usually that young people, because it's focused at young people, might have, and then there can be questions related to that blog or other questions which our nurse Nettie answers those responses, and the types of questions that Nurse Nettie is asked also inform what the blogs will be about. So we have also produced games, a game called Chlamydiastic for health promotion staff to play with young people to really emphasise that chlamydia is an infection that is readily transmitted and can be asymptomatic. We have our own website, which is quite comprehensive and has a tool there where people can go on and assess their own risk. So that tool then directs them to the most appropriate service for their particular problem. So all publicly funded sexual health services in New South Wales are free. So treatment for bacterial STIs is provided for free, and there is no requirement to have a Medicare card, although for some services it is encouraged to use a Medicare card if you have one. But if people don't have Medicare cards, then they can be seen as long as they fulfil the triage criteria that the services apply, or that we apply here at Sydney Sexual Health Centre in particular.